fourth trimester. Well, I think we can get started. More and more people are joining, excited to kick this event off. So I'm sure we'll have people continue to join, but want to thank everyone for joining Origin and then the team at Rosy for an event around what you need to know for your fourth trimester. I actually had never heard the phrase fourth trimester until a couple of years ago when I had friends start to get pregnant and then have newborns. And it's just, I mean, it's so apt because it's such a transition time, both physically and emotionally, that happens from when you're pregnant and that third trimester to your day-to-day in and out with a newborn. And so I'm excited for this discussion. We're going to touch on everything from what happens to your body, what it means for intimacy, and just to hopefully give you a lot of different resources and tips that will help you and make you feel prepared. So excited to share more on what to expect. And we have Ashley, who's a pelvic floor therapist, and Dr. Lyndsey Harper, who's an OBGYN by trade, and the CEO and founder of Rosy. So I'll just do a quick housekeeping and then we'll get into this content. But a quick reminder, we will be recording this session and we will share it out with all the attendees or anyone who registered afterwards. So if you have to hop off, if you are dealing with a newborn and something come up, no worries, we'll provide all the content after the fact. I know we got a lot of questions in advance, which is awesome. So I've shared that with the panelists. We'll try to address some of those during the discussion. But if there's any other Q&A that comes up, feel free to throw it in the chat or into the Q&A box, and we'll make sure to try to cover those. And with that, I'll just kind of get started on the content. So I'm Allison Grant. I lead the marketing team here at Origin. And a little bit about us is we are a women's health company focused on pelvic floor physical therapy. I'm really focusing on the pelvic floor and the whole body. So, everything from painful sex to postpartum recovery. We work with women both virtually and in person in a couple of states as well to help them access this type of care. We're really big believers that all women should have access to this kind of care at every stage of life. And so one of our most exciting pieces of Origin is that we are in network with most major commercial insurers, which means that you hopefully aren't paying on an arm and a leg to get access to this type of care. And actually, Dr. Harper, do you want to introduce Rosy?
Yeah, for sure. Well, I'm so excited about y'all's insurance coverage as well. That's really a big milestone. So congratulations. So as Allison mentioned, I'm Dr. Lyndsey Harper. I'm an OBGYN. And when I was in private practice, really needed resources for my patients with sexual health problems. For example, low sexual desire, trouble with sexual pain, trouble with orgasm, all kinds of things that 43% of women are struggling with. So when I couldn't find that for my patients, I decided to create Rosy, which is a platform with evidence-based solutions for women's sexual health. So we really appreciate and understand that women's sexual health is multidisciplinary and that there's medical issues that could be going on. There are mental health issues, there are pelvic floor issues, there are relational issues, maybe even some issues with self. And so that's how we really approach women's sexual health, is from a holistic and multidisciplinary approach. So on the platform, we feature lots of different experts like physicians, psychologists and psychiatrists, pelvic floor physical therapists, and we have lots of different resources to try to educate women about sexual health concerns and then to offer evidence-based interventions. So we're thrilled to be here today to talk about the fourth trimester with Origin and answer whatever questions might be on your mind, because that's what it's all about, is access to education and intervention. So that's what we're all here for.
Amazing. And I know Dr. Harper just gave a little bit of an introduction, but as she mentioned, she's the CEO and co-founder of Rosy, which we are so excited to partner with. We've worked on some content together too. And I just think that giving women more access to education and understanding their own body is just a win for everyone. And then we also have Dr. Ashley Rawlins, who is our lead physical therapist in Texas and based out of Dallas. She specializes in pelvic floor, muscle dysfunction, everything from pelvic pain to sexual dysfunction to pregnancy and postpartum and so much more. And so I am going to turn it over to the experts to talk through our event today, really what you need to know about your fourth trimester. So I will hand it over to Ashley to kick things off.
Yeah, so we want to go over this whole concept of what the fourth trimester is, this period of time after pregnancy that is a bit undefined and maybe even a newer concept, I guess, in the grand scheme of things, this time when you are still going through a tremendous amount of change, both in your body, but in your family, in your social life. And it's such an important time to nourish and heal and prepare for the years to come. So we kind of want to bring it to light today and kind of go through information, like what is the pelvic floor? What is normal function for that pelvic floor, for your pelvis, and the functions that go along with it? We'll go through pregnancy, labor, and delivery, and the changes that occur through that span of time, and then look into the postpartum and beyond. And hopefully we'll go over all of your questions along the way. So what is my pelvic floor? We get this question a lot. I think pelvic floor is one of those things that we hear about all of the time. I need to take care of my pelvic floor. I need to make sure my pelvic floor is healthy. But what is the pelvic floor? First of all, what does healthy mean? So in general, our pelvic floor is this group of muscles at the bottom of our pelvis. We have an image here, and then from an anatomical perspective, here's a pelvic model. They are this group of muscles here at the base of our pelvis that go from our pubic bone to our tailbone, and then between the two sit bones to form this hammock of muscles at the base of our pelvis. And they, as you can see in the picture, they help hold up and support our pelvic organs against gravity. They contract to help stabilize and close the pelvic openings to improve continence, so leakage of stool and urine. With the support, they stabilize our spine. They are part of the abdominal support system. So with our diaphragm, our respiratory diaphragm, and our abdominals and our pelvic floor, they help to stabilize our spine. Of course, they're important in sexual function with support through the pelvic openings, and they also help to pump blood flow and lymph through our bodies. So what is normal for the pelvic floor? Normal is so varied, of course, but in general, we're looking at the functions of the pelvic floor as far as urinary function goes, bowel function, and penetrative or sexual function. So with urination, we want to see voiding 5 or 6 times a day of a full bladder. So not too often, you're not holding it for too long, but you're going about once every 2 to 5 hours throughout the day. There shouldn't be any leakage of urine unless you're in this first 6 weeks or so of your postpartum period. You should also be able to easily and completely empty the bladder, and you shouldn't have any urgency, like that key in the door syndrome where you're trying to rush off to the bathroom and feeling like you can't make it there on time. Bowel function is also very variable, but what is normal is being able to have a bowel movement 3 times a day to 3 times a week. That's painless. You shouldn't need to strain. And we have this little Bristol stool chart over here on the side. You do want to have like a nice normal stool. We typically type 4, so a smooth stool is what's considered normal, but there is always some variability there. And then sex should never be painful. It should be pain-free, pleasurable. You shouldn't be able to have pain with tampons, pain with pelvic floor exams. Those would all indicate that maybe something is going wrong there.
And actually, one thing that I know. Oh, go ahead.
I was going to say, I learned something with this webinar. I've never seen the Bristol stool chart before, Ashley. So thanks.
Oh, no. Yes. I know. Leave it to us to be like, look, what does your stool look like? And you maybe you've never turned around and looked, but it can tell you a lot about your health, about your GI health. If there's dehydration, or if you need more fiber, or if, you have slow transit and all of that.
Learn something every day. Seriously.
And actually, one question I know that we got in advance was just like, how does your pelvic floor help you? Why does it matter? Why should we care, I guess?
Yeah, well, they are this powerful muscle group at the bottom of our pelvis. And, with the functions being stabilization, helping you with continence, sexual function, helping with circulation, our pelvic floor muscles are really foundational in helping to support, keep you moving, keep you, without leakage and stable. They're an important group. They help support the baby when it's growing, to allow for labor and delivery. There's so many roles and functions of this pelvic floor you don't even really think about until there is injury to those tissues.
And one thing, Allison, on that last slide that I think is so interesting from a women's health perspective, just actually generally, but specifically when it comes to sexual health and when it comes to pelvic floor health, is how much so many of us as women sort of normalize or rationalize symptoms that we have that are just abnormal,
totally.
right? Like in terms of leaking or in terms of urgency. And it's kind of like, I think there's a narrative, right, in society that, oh, once you've had a baby, well, you probably leak. And maybe as you get older, well, you have some urgency. And I think it's really important. And the same goes true with sexual function. I think it's really important to know that, you know, these symptoms are bothersome to you, that you don't have to live with them, and that there are, you know, really safe interventions to help with those.
Oh yeah. I mean, I was just on a hike with my aunt a couple of weeks ago, and she had a cold, and she was like, well, you know, I have to wear a pad when I have a cold because when I cough, I leak. And I was like, you know, that's either ways to work through this. And she was like, well, it's just when I have a cough. It's like it's only when I have a cough. And I was like, sure, but you could cough a lot of times throughout the year.
Right. Yeah. Exactly. And maybe it's not super important to someone, like maybe just a little bit of leakage here and there is not bothering them, but it might be a sign or like a warning that maybe there is vulnerability that could further be injured, and it's something that you don't have to live with. So pregnancy and labor and delivery, then how does that kind of pile into all of what's normal? You know, in pregnancy, we talk a lot about strengthening your pelvic floor and making sure that things are strong and well for pregnancy and delivery. And it's important to help prevent complications like urgency, urinary urgency or incontinence, or even pelvic organ prolapse, which is like the dropping of your pelvic organs into the vaginal opening, the anal opening. And they help to improve the stability of the pelvic girdle and decrease pain in your pelvis and your low back, like your pubic bone, your low back and your buttocks area, by providing stability to that whole pelvic girdle. And then they also help with the fetal cardinal movements during labor and delivery. And I don't know what your take on that is, Dr. Lyndsey Harper, but there is lots that those pelvic floor muscles can do to support those movements.
For sure. I mean, definitely in labor, you know, just like you see whenever you're treating patients, Ashley, there can be definitely like pelvic tone or pelvic floor laxity, and also pelvic floor, you know, I would say hypertonicity or like tightening, right? And we want to find this happy medium for all patients and for all women to sort of lessen symptoms on both sides. So as I know we're going to talk about in a minute, you know, more is not always better from a labor perspective in terms of pelvic floor tone, but I think definitely having, you know, control of those muscles, having starting at a nice strong baseline, and then those muscle fibers getting stretched allows them to come back together more easily after delivery. So I think it's something really to, you know, think about. Not that we need another, you know, form of pressure or guilt, right, while we're growing these other humans inside of us.
No.
But if we're looking to optimize, then there is an opportunity there for sure.
Exactly. And so like she was saying, that release is just as important, because eventually we need that baby to come out. And when we're focused all on this, like strengthening and toning and getting strong for labor and delivery, we also need to learn how to release and open the pelvic floor, which maybe isn't as intuitive as you would think. We want to strengthen them, but we also need to be able to open them and lengthen them. And so practicing pushing is something that we often recommend, so that you can kind of work on the coordination for when, for game day. Also, our pelvic floor changes as our body changes. The pelvis is spreading, and our center of balance is different. So our pelvic floor will adjust for that. So doing things like exercising in different positions can really be helpful for that pelvic floor, to see if it's easier to squeeze or relax, and kind of get to know that pelvic floor throughout your pregnancy. Got a little freeze. There we go.
Yeah, I'm going to talk a little bit about sexual function during pregnancy, because I think there's so many myths out there, right? There's one myth about, oh, when you're pregnant, you're going to have a really high sex drive, and everything's going to be rosy, for lack of a better term, right? And it's going to be all good. And I think that it's really helpful to know that not everyone, and in fact, probably no two people have the same experience when it comes to sexuality during pregnancy. And oftentimes, even one one person can have multiple experiences throughout one pregnancy course, and then that doesn't necessarily repeat itself during subsequent pregnancies. So I think that's the best thing for us to all remember, is that there is no real normal, and there's no baseline of what to expect when it comes to sex during pregnancy. But during the first trimester, a lot of us experience as a progesterone effect. So as that progesterone rises, which really supports the pregnancy, some nausea, right? We all hear about morning sickness. Now, not all of us experience it, but for those of us that do, that can be extremely disruptive, especially when it's prolonged. You just kind of feel bloated and full, like you just kind of ate too much or ate the wrong things frequently. Oftentimes struggling with constipation, especially if you're on medicine for the nausea and vomiting. So those things can really not be very sexy, right? You're like, I know the baby or the fetus is tiny, but I feel really bad. It takes a big effect on your gastrointestinal health, for sure. So that may be one reason that, affects your sex drive negatively. Another thing that happens for a lot of women, also as a side effect of that progesterone, which is supporting the pregnancy, is that your breasts enlarge, right? Which one might think, or your partner might think, is a good thing, but in fact they're actually super tender. And so you're like, you can look, but you can't touch, right? And so that can have differing effects on sex during the first trimester. And then I can speak for myself from personal experience with my first pregnancy. I'm an OBGYN, right? And I was still nervous about like running during pregnancy and having sex, especially very early. And I'm like, just think, it's so tiny, like, isn't it going to jostle around? No, it doesn't. Like, the fetus is protected in the uterus, the placenta's there, that we're allowing for a lot of movement during pregnancy. So in reality, like as a science person, as a physician, we know that actually having sex does not affect a very early pregnancy, and that it's totally fine. But sometimes that anxiety is a little bit hard to work through. So those are some reasons why, if you're expecting an increase in your sex drive from your hormones, you might not experience that during the first trimester. In the second trimester, usually we're starting to, notice some resolution of some of those gastrointestinal symptoms. We might have more energy than we did in the first trimester. And, at the same time, the belly and the pregnancy itself is growing. So that's oftentimes when, as pregnant people, we might experience an improvement in our symptoms, and then maybe also an improvement in our sexual experience and interest in sex. But that's not the case for everyone. And this is also sometimes the time where we find out maybe about pregnancy complications, or about, a reason why you shouldn't have sex. So what we like to say is that sex is okay during pregnancy, really across the board, unless your OB provider has told you otherwise. So I don't want anybody to worry about having sex unless your physician has instructed you. And, going back actually to the first trimester, I've treated obviously lots of patients with miscarriages. I've had a miscarriage, and I just always want to convey that sex is never the cause of a miscarriage in that first trimester. There's lots of reasons for miscarriages, but sex isn't one of them. So I just want to make sure to share that with everybody. And then also in the third trimester, right, we're getting more pelvic pressure. So the symptoms become less about hormonal symptoms that are happening throughout our body, and more about those pelvic floor symptoms that are really putting a lot of weight on our pelvic floor. So we have some more pressure. So sometimes with penis and vagina sex or intercourse, that can be quite uncomfortable. So there are certain positions that can be a little bit more comfortable in that case. And that engorgement of the pelvic floor tissues can also sometimes cause some swelling, some varicose veins, that then can make sex a little bit less comfortable. And also, if you're laying flat on your back, right, the weight of the pregnancy can compress the big vein that returns your blood back to your brain and your heart, and that can cause you to become short of breath. So once again, another reason to bring in some other positions. So all this to say that whatever your experience is, that's totally fine. And there are ways to sort of give yourself permission to be with whatever symptoms you're having, and also sometimes opportunities to work around those to maintain intimacy. And we don't always, and we talk a lot about sex at Rosy, so you'll have to forgive my frankness, but we don't always have to have penis and vagina sex to maintain intimacy, right? There's other ways to be intimate with our partners, and to also stay close with that sexual side of ourselves, because that's an important part of who a lot of us are as women. And so it's important to, stay in touch with all of those reasons that you might want to remain intimate during pregnancy.
And it's so important to talk to your doctor about those things,
Yeah.
because maybe it's embarrassing to bring it up, or you might think that they don't want to talk about it with you or things like that. But it's what they're there for, and they have the information, for you, and solutions and ways to help keep you, sexually active throughout your pregnancy if that's what you want. So don't be afraid to talk about it.
For sure.
So postpartum.
Now to the juicy, the fourth trimester.
Yes.
Dun,
The
dun,
fourth
dun.
trimester.
Okay, so just really quickly, I wanted to just go over, because I think a lot of people have no idea what to expect at their 6-week postpartum visit. And it's just such this like line in the sand, right? It's like, well, we had this whole pregnancy and birth, and then we're kind of like, kind of out in the wild with this new child, and what in the world are we doing? Yeah, it does. And you're like, are you sure I get to go home with this kid? Like, did I have to sign her out or something? And then we have this 6-week visit, right? And oftentimes there's so much around the 6-week visit, going back to work, going back to sex, like checking in with your doctor about this laundry list of things, or your midwife or whomever your provider is, about this laundry list of things that have been on your mind, since you became a mom or a second time parent or whatever. And so I think it's so much. And I think it's such an opportunity really to connect with your provider, but there's also some other ways to find sort of some answers. So I would love really to kind of go over, from a physician's perspective, what our objectives are at that visit. Really, we want to check in with parents and say, how have y'all been doing, right? How have we been sleeping, which probably you haven't been, so that's a terrible question. How's your mood been? How's your bleeding, right? Is it very heavy? Is it kind of weaning off? Has it stopped? And then what are we doing to feed the baby? Are we breastfeeding? Are we pumping? Are we bottle feeding? And which all are wonderful. Fed is best. And we just want to make sure that we're supporting you with whatever choices or struggles that you might be experiencing. And then it's also important from a physician's perspective, however the baby came out or tried to come out and then came out another way, that we examine you and make sure that everything is healing like we would expect, right? So if you had a C-section, we'll check on that abdominal incision, make sure there's no signs of infection or anything worrisome going on there. And then we also do a pelvic exam to really look and make sure, are the labia, if there was a tear, the labia and the perineum all healed? Is the vaginal wall looking normal again? And up at the cervix, is the cervix, looking normal, any problems there? And then we check with what we call a bimanual exam, which means 2 fingers in the vagina and then a finger on top of the tummy to check on the size of the uterus. When we're not pregnant, the uterus is about the size of our fist. Then it grows as big as you see, right, to the size of your baby, all the way up to your diaphragm, and then it should shrink back down, maybe not all the way to this size, but probably about this size by the time you see your physician. So we're just checking to make sure that the size of the uterus correlates with what we would expect for where you are in your postpartum journey. And so sometimes that can be a little bit uncomfortable, right? An exam, you haven't had anything in the vagina for the last 6 weeks, no sex. And so there's some definite anxiety that comes along with that. And then some other important pieces of the visit are, we should definitely be screening for depression, right? Postpartum depression is a very serious issue that deserves and should be addressed at every postpartum visit. Something 100% to speak up to your physician about if you're feeling like you're struggling. There's lots of ways we can help, and we certainly don't want you suffering alone. Also, as Ashley mentioned earlier, a baby, especially the first baby, and also sometimes the second baby, because now your partner has to do more work, can cause a huge stress on a relationship that you can't really plan for, that you don't know really how to negotiate prior to. So that's important to address. And then prepping for sex after birth. So these are all really, really important things. The one thing I left off of this list is oftentimes a discussion around contraception as well. So if you're thinking that you are, you desire some type of contraception, what might that be? How does that fit with your, spacing of pregnancy goals? How does that fit with your nursing or breastfeeding goals or pumping goals? And how does that fit sort of with your lifestyle and medical risks? So that's another important thing that should be on this list for sure.
And we had a question, I know someone had asked sort of if they are, in their 4th trimester and are bleeding with exercise, like, is that normal? Is that something to be concerned about? I'm sure obviously it's case by case, but what would you say, I guess, to that?
Yeah, I would say it depends on how close they are to delivery, what their bleeding pattern has looked like since delivery. Like, did it stop and now it's just happening with exercise, or this represents a slow taper? What does their exam look like? Is their uterus back down to normal size? Is their perineum and vagina all healed from tears? Are there any areas of concern on the cervix? So I would say, just like you answered, Allison, that it is a case by case, and probably if you're outside of the time where you like your bleeding had resolved and now it started back, then I would just bring that up maybe with a phone call to your physician. Or if you're still experiencing very heavy bleeding while exercising, if it's just spotting and you're still kind of in that, I would say first 3 to 4 weeks, I wouldn't be too concerned about it as your physician, but really you should, not knowing anything about whomever asked this question, and this is not medical advice, by the way, we forgot to say, Ashley, that call your doctor is the right answer for me to say on this webinar where I have no information.
Absolutely. I know it's always, and from a physical therapist perspective too, that is always the go-to, right? I mean, maybe there's some normality to it, but if you're experiencing bleeding, it's certainly something to bring up and speak with your physician over, because there's so much that can go on and occur in that time. And as far as that pelvic floor function in the postpartum period, the first 6 weeks, like I said at the beginning, you might experience some leakage. And there was a tremendous amount of strain that happened if you had a vaginal delivery, stretching and straining of the nerves, the muscles, the ligaments that can be bruised, or that might lend to a little bit of the urinary leakage. And as your healing and inflammation is going down and your blood volume is stabilizing, leakage of urine happens in those first 6 weeks. You should feel that resolving as you move into that 6-week period. And if at that point you're still feeling leakage, that might be abnormal and something to look at. In general, it's okay to start doing gentle Kegels in the first 6 weeks. For the most part, we're looking at staying away from a whole lot of exercising that might kind of complicate any wounds that are healing. We don't want to compromise any wound beds, things like that are occurring. But some gentle Kegel breaths or Kegels with breath, it's just really just kind of flickering those pelvic floor muscles to help with getting that muscle back on board, circulation. It can help to reduce inflammation and really be a proactive way to kind of start your healing journey. After 6 weeks, you do need that clearance from your OB or your midwife for any sort of vaginal penetration. You want to make sure that you're not introducing any bacteria to things that are healing in those first 6 weeks. But if you are continuing to have leakage or heaviness, feeling like you're falling out, this wouldn't be considered normal at this point. It would be something that you'd want to look into further. You, at that point, can start doing more strengthening using pelvic floor trainers. We have a couple of pictures of options here. These are more like your at-home, self-guided types of exercise tools where you are inserting them in with the magic of Bluetooth, playing video games on your phone to help train, condition, and train those pelvic floor muscles. We have the LV, the Kegel, and the PeriFit are really great options for at-home treatment.
And Ashley, we had a question. Someone was experiencing leakage specifically around PMS in the postpartum period. Is that something that would be normal to experience, or how would you think through that?
So that's a great question. And I might even hand a bit over to you, Dr. Harper. I think, in general, we have ups and downs and ebbs and flows of our hormones that can significantly affect our ligaments, our muscles, the positioning, things like that can affect our continence and our sexual pain and things like that. It's definitely something to kind of check into. But what are your thoughts on that, Dr. Harper?
Yeah, honestly, I haven't heard that specific sort of alignment of symptoms before. But I, just like you, there is some basic science knowledge of hormonal effect on the body where I can make the stretch that could be what's causing this. I think that the important thing is that it looks like that this person is doing physical therapy, and just to be watching for improvement, and otherwise, if not, to be sort of discussing with the physician. It could be that like around the time of menstrual flow that uterus is just filling up ever so much, and that there's a little bit of like anteversion, right, since birth. So the uterus can kind of sit straight up in the pelvis. It can be a little bit tilted back, or it can be a little bit tilted forward. So it may be that during birth your uterus just got a little bit more lax in its position in the pelvis, and then when it fills up around the time of your menses or right before your menses, then it puts a little bit of extra pressure on the bladder, which has this really nice intimate relationship with your uterus, and that's just enough to kind of push it over the edge. So I would imagine, though, that could definitely be overcome with strengthening of the pelvic floor muscles to override maybe that little bit of extra pressure that you're experiencing. On this slide, though, two thoughts came up for me. The first is that, like, after I had my children, I always would try to do Kegels, like in the like postpartum room, like still in the hospital, and like I literally just couldn't do them. Like my pelvic floor was like, no thanks, we're good. Yeah. And so it like took a while until I could even like rejoin those fibers, until they would even respond to me. Yeah, that was.
Well, it's funny. We have a statistic coming up on one of the slides, but about 40% of us, when we try and do a Kegel, do them wrong. And there can be a whole number of reasons why. Maybe there's like a motor, issue sometimes where it's kind of like, I think about like if you like saw me dance, like it can be. Yeah. Like it's hard to coordinate sometimes, and our pelvic floor muscle is just like muscles in our in our legs or whatever. This is skeletal muscle that maybe has a hard time kind of functioning, especially in the presence of injury, when maybe our brain like kind of protects over that area. It doesn't want further injury. That there is this tendency to kind of want to protect the area, and maybe we have a hard time rejoining and there's swelling, things feel off, and it's hard to do. But then sometimes maybe we didn't do it right to begin with. A lot of times when we to cue a Kegel, oftentimes we'll see pushing out or straining of the pelvic floor versus contraction and holding. So it happens all the time, especially in that injury. So.
And is there a way to know, awesome. I think I have an idea, but other than these like pelvic floor like technologies, which I have, I have the LV, are there ways to know that that you're doing a Kegel right? Like, can you, I know that as a physician, like I can maybe check and you can maybe check, but can a person or a patient check?
I always recommend getting out like a hand mirror. I think that's something that everybody needs to do, regardless of whether or not you're trying to do a Kegel. Like getting out a hand mirror, looking at your vulva, seeing, what your pelvic floor external anatomy looks like when it's normal, because then or when there's not symptoms, because then you know what looks off if you're starting to kind of, I didn't know, did tissue hang down there before? I don't know, because I never looked there before. And it's true, like, but being able to kind of visualize, get my pelvic model out here. I oftentimes, when I'm examining, I'm looking externally at this perineal body. So this is the space between the vaginal opening and the anal opening, where a lot of our pelvic floor muscles join. It's kind of like this central tendon area. And when we contract, this perineal body goes up towards our head, it kind of pulls everything in. We also see the skin, which is not on this here, but the skin over the clitoris is called the clitoral hood. And there will be a bit of like a tucking of that on the contraction of a pelvic floor. And then you can also see kind of closure of the anal opening with a Kegel or a pelvic floor contraction. But there can also be confusion there, because sometimes we're using our bottom muscles or our lower abdominals that also can, with fascial connections, encourage a pelvic floor contraction when maybe we're just doing an abdominal contraction. So it's also okay with a clean finger to insert your finger into your vaginal opening and do a squeeze to feel, is there tightening around that finger, or am I pushing out my finger? What's going on there?
Great. Thank you.
All fun ways to assess.
Yes. So fun.
So how to navigate this next year? Oh, go ahead.
Oh, no, I was just gonna say, I think like the topic we're gonna talk about next, I feel like is the boogeyman of this fourth trimester, like the return to sex postpartum.
Dun, dun, dun. Yeah.
Well, yeah, and we talked about this, like, so 40% of us really aren't doing those Kegels right. But they're not also a one-size-fits-all type of treatment for your pelvic floor. So like we talked about, this is not specific individualized advice for those that are attending, and it shouldn't be construed that way because there's so much variability from person to person. But in general, those are the things that we're kind of looking at and thinking about. Kegels are important, but they're not for everyone. This is this contraction, this strengthening exercise for our pelvic floor that can increase the power of a muscle, its endurance, its coordination. But if your muscles are too strong or too overactive, sometimes we lose the ability to, or our brain kind of forgets how to relax that muscle. And it can occur for all sorts of reasons, overtraining, and maybe we don't relax the tissues. And over time, like if you think about your hamstrings, they can shorten, and it's hard to release those muscles after contraction. And even, we've talked a lot about vaginal delivery, but in cesarean section, your pelvic floor is not spared, unfortunately. Right. I had a cesarean section. This is not spared, especially if you do have trial of labor. But right. You can't forget that you also had 9 months of change in pregnancy, some contractions that may have affected the cervix. Oftentimes after cesarean, you have tension in the pelvic floor. It's a tremendously significant surgery, and there's healing that needs to occur. But if you are experiencing more leakage or urgency or painful sex, Kegels are the opposite of what you're wanting to do. Things more like diaphragmatic breathing, releasing of the tissues are more appropriate for tight, tender pelvic floor muscles.
All right. So now we're just going to chat through whenever you have had birth, right? Whether it was a vaginal delivery or whether it was a C-section, then what to expect really the first time after your birth. My most recent birth is standing here looking at me, so I'm going to usher him out of the room. Just 1 second.
Oh, that's amazing.
It is such a scary and important changing time in our lives, right? There's so much that has occurred. There's so much going on. You have a new life. You're exhausted. You're overworked. You're overtouched. If you are breastfeeding, you're definitely holding the baby all of the time anyways. And there's so much that can factor in to what can make sex in the postpartum period challenging.
Totally. Thank y'all for your patience. I know that y'all know what it's like.
I love that happened. I think it's perfect.
Yeah.
I could have brought him on screen, but then he would have never left. So that would have been a big risk. He would have heard all about sex the first time after birth. Not that he really knows, but that's fine.
Just baptism by fire there.
Yeah. I mean, I have vulva puppets and, everything all around. So it's fine.
Dilators.
Yeah, exactly. It's not that big of a deal. So anyway, so everyone's like waiting for this 6-week mark, like, right, did your doctor give us permission? And then I know a lot of people are asking for like, hey, can you give me more time? Like, I think there's a lot of anxiety about going back to sex. And the other thing is that, I think it's really difficult, just like Ashley was saying, like a lot of us are, and I would say maybe all of us, I think it's a nice generalization, are just truly exhausted. There's a lack of sleep. There's, this other person who's depending upon you for their life. And it's a lot to take in. So the idea of just adding sex back at that point, especially when you're nursing or, just trying to feed the baby every 3 hours is a lot to do. But physically, when we look at the vulva and the vagina, whenever we are postpartum, there's definitely still some healing going on at 6 weeks, right? And for the pelvic floor as well. It's not as if, there's a magic fairy OB wand and we're like, and you're back to normal or back to your prepartum days. It's true that things have changed and healing takes longer than 6 weeks, but 6 weeks is probably a fine rule of thumb to guide, when you can go back to having sex for most people. But at that point, you might still have some discomfort. Sometimes it's on the perineum or the vulva because of dryness. So many of us, as a result of pregnancy and lactation or breastfeeding, nursing, making milk, you would experience a decrease in that estrogen. And estrogen is what makes our vulvas and vaginas plump and moist and receptive to penetration and also friction. So when you don't have that estrogen that you need, then there can definitely be some dryness. and that's actually really common. So we talked down here about tips for your first time. Definitely lube is like where it's at, right? And there's no shame. We at Rosy know that, most women, whether they need lube or not, experience greater sexual pleasure with lube. So it doesn't mean anything about like, are you turned on or do you like your partner or whatever. It doesn't really mean anything. It's just kind of great to have around, and especially when you're having sex for the first time or for the 20th or 100th time postpartum. And then, I think it's okay to like say, okay, and maybe have a conversation with your partner beforehand. Like, hey, let's give this a shot, but let's have, let's have maybe some other alternatives to maybe penetrative sex, penis and vagina sex, where we can still express intimacy if I'm not feeling comfortable with this, right? If I'm for whatever reason uncomfortable, if this is painful, if whatever is the situation, or maybe we just give it a try and then stop if for whatever reason you want to. I think it's worth that conversation ahead of time just to kind of level set expectations. So we talked about lube, which I would highly recommend, and I think there's some recommendations for that. Also, just to go slowly, right? You want to make sure and give yourself time to be responsive to becoming aroused, and that might take longer than it did before you had this baby or before you were pregnant, because changes in hormones, because fatigue, because physical changes. Oh, one thing I also left off of here are just body image struggles. 6-week postpartum, we cannot expect for any of us to feel like as amazing about our bodies as maybe we once did, or maybe even we did during pregnancy. There's a lot of changes that we've experienced, and we know, just like this multidisciplinary model of sexual sort of challenges, that body image is a huge I would say struggle that many of us have, and postpartum is probably the most dramatic time because there's such a wide swing of maybe where you were 6 weeks ago and where you are now, and sort of where your ideal is in your own mind. And so there's several things to work through. So you want to make sure and give yourself some space and try to be kind to yourself with that, and know that your partner is clearly eager, right, for intimacy with you, or else this wouldn't be an issue in the first place. And then also, if you're making milk, then you can really predict that with orgasm, with pleasure, that you're going to be expressing milk, and either that's cool and you can go with it, no judgment ever, or if you want to like wear a bra or wear a little bralette or whatever, just expect that that's going to be part of the experience, and that way you're not like shocked or taken aback, because that's a really normal thing that happens with orgasm for sure.
I had a great story of a friend where this happened to her. She started expressing milk as she orgasmed, and her husband, knows that milk was like liquid gold. And so he was like trying to baby bird the milk to try to catch it, because he was like, I know this is valuable. We've got to save this.
That's amazing.
And she was like, I didn't know this was going to happen. So I'm so glad you brought that up.
That's such a good story.
It is a great story. Yeah. And it's one of those things that it is, thank goodness you talked about it, because it happens. And it's normal, and it shouldn't be something to like have shame over. And I think it's fun to kind of laugh through and experience, but knowing that it's okay is helpful. Especially we
had some questions. Oh, go ahead.
No, go ahead.
I was gonna say, we had some questions too, just around like the decreased sex drive while someone was nursing. Is that like correlated, or can that be expected?
Totally. Yes, that's totally normal, totally expected. There's so many things going on, right? You're getting touched, right, in all of your like sensitive, intimate areas all the time, and you're making milk, so your estrogen is low. Your vagina is usually kind of dry. You're feeling kind of like maybe not great about your body image. There's a lot of changes that have happened with the relationship. So I think postpartum in general, there are reasons that sex drive is lower, and then lactating on top of that, for some women can compound those issues. Usually at about 6 months, we see from a hormonal perspective that estrogen level starts to rise again, and a lot of the hormonal effects from lactation sort of start to decrease in terms of their level of severity. And so really it's about during that time, negotiating, right, your needs and wants, your partner's needs and wants. Where can we utilize our communication skills to really come to a place where, and it's not our job to address our partner's sexual needs, but to maintain that level of intimacy for ourselves and for our goals within our relationship. So there shouldn't be a lot of pressure to have a lot of sex postpartum, but I think the further, and I know because science, the further we get from intimacy, sort of the less we remember why we liked it in the first place. It's kind of like exercise where you're like, Netflix, like whatever, Working Moms episode 20, you're like, why do I even get that Peloton? That is dumb. And then you get back on it and you're like, oh, I feel amazing. Sex is just like that. And so I really try to encourage people to sort of stay in that positive sexual response cycle, because, if you get too far away from it, then sometimes you kind of forget why you ever wanted it in the first place.
Totally.
Oh, but man, Working Moms is so funny.
It's so good. I just found out about it and I'm like addicted now. Yeah, it's good.
Yeah, well, I mean, and there are so many reasons kind of, like we talked about, but returning to sex after baby, there are so many reasons that makes it less comfortable. We talked about the decreased lubrication in the breastfeeding, your lower estrogen levels, but also from an injury standpoint, the scar tissue that can be present after tearing from delivery can be a really big barrier. So what we have, it's common for there to be tearing into the perineal body area. Tearing can occur into all of the perineum, but most commonly kind of down towards in this direction where the head is able to kind of push and put a lot of pressure. That tissue then will scar in its healing process. Sometimes that scarring process can be disrupted, or that healing process can be disrupted in a way that might affect the healing and pain. So if the nerve is affected with scar tissue, then there can be some pain that occurs with that. Maybe there was re-injury to the tissue, and so you have delayed healing, and there is more sensitivity there because of that. Maybe you just scar in a way that is restrictive, so the tissue is less flexible. And then the muscles themselves can respond to that injury. We talked about, when we have an injury, it's like hard to get that muscle to move, and that guarding can lead to tension and pain and overactivity that creates, decreased ability to have penetrative intercourse. There's also birth trauma that can significantly affect you emotionally, and how, I'm afraid of this area of my body and what could occur if I touch or think about or look at that area. And like we talked about, the body changes are so interrelated with our desire to return. And that goes all the way down to what my vulva looks like now. Does it look weird? Does it look different? Is my partner going to notice and be like freaked out by it? And who do you ask? Like, what does my vulva look like? Is this normal? It's so complicated in the postpartum period. It's such a difficult time to navigate. But you're definitely not alone, and you deserve pain-free and pleasurable intercourse. Definitely use lubricant. There are some really great blogs on your website about all the different, on the Rosy blog, about all the different areas of lubricant. It doesn't need to be like your KY jelly. There's so many luxurious, amazing lubricants out there that are fun to experiment with and use. And it's, like you said, it's not something that means you're less, have less desire or things like that. It's just a fun thing to play with as you get older, and you deserve to spend a little bit more on lubricant after baby.
Totally. Couldn't agree more.
Yes. And practicing diaphragmatic breathing daily can really help to kind of, one, connect back with that pelvic floor, because it moves normally and naturally with our diaphragm when we breathe. And go slow, and you return back to intercourse and communicate. Don't force it. Don't have this I have to just do it and have intercourse. That might backfire and contribute to more of the birth trauma and pain that you have.
Okay, well, and I know we still have a bunch of questions. So if you have any questions, feel free to plug them into the chat or the Q&A. I know we had several kind of OBGYNs who were who'd signed up for this as well. And so as you think about Ashley or Lyndsey, like what is helpful for them to know, to share with patients, to like better prepare their pelvic floor or better prepare for that fourth trimester? Are there any sort of like resources or just like kind of basic tips that come to mind to share?
Ashley, I want to hear what yours are. I feel like you know the things we
Well,
don't.
in general, I feel like the most important thing to know about your pelvic floor and birth is that you have a pelvic floor that can go through injury and change, and that some of these changes and injuries can contribute to what might be occurring in the postpartum period. And that it's not likely, or it's not, I know this, it's not just because you had a baby that you have leakage and then that's just what you're going to have for the rest of your life. But just providing that education that there's a possibility that you'll have injury and these symptoms may occur, instead of not mentioning it and kind of letting someone navigate those fields on their own, just bringing it up and then kind of, but there is, help out there for symptoms like this. And just bringing in an awareness to, I think, can take away so much shame and confusion and, being unsure about what is going on in that postpartum period. What are your thoughts?
Yeah. Oh my gosh. Well, I mean, I just think that this is a great opportunity because most of us OBGYNs in practice are not great about talking to our patients about sex because we don't really get a lot of training on these issues. But this is one time whenever it's expected and whenever we usually do feel comfortable talking about it. So I just would use that as a jumping off point to really, counsel extensively about what to expect, what's normal, what's not normal, right? So some discomfort when you first get started back to having sex is normal, but some prolonged pain, certainly not. And I know, Ashley, that you said this, but we definitely don't want patients tolerating pain postpartum because it can really worsen sort of all the prolonged sexual challenges moving forward. And so early intervention is always better. So if a patient is having difficulty, I would say maybe counsel them at their 6-week visit about how it's supposed to go. And then really, encourage them, just like we might for mood symptoms or bleeding, that if these sexual issues are outside of what we would expect in terms of normal, then we really want them to let us know so that we can get them to the right resources for improvement and not, make worse the negative sexual cycle that can ensue if it goes on too long.
Yeah. And great resources available. I mean, check out the Rosy app. There are amazing resources in there and for what is to come and what to know about. And we have so many resources on the Origin Way website as well, from sound advice from healthcare providers, not opinion pieces, but evidence-based information about pelvic health, return to sex, sexual function in general. And going to a place where you're having great sound, evidence-based information is always the place to start.
Absolutely.
Yeah, and we had a question.
Go ahead. Go ahead. I was just going to say that Ashley, and then also a perinatal psychiatrist and an OBGYN who specializes in sex medicine, created a series of classes for us. The one that's free to everybody on the Rosy platform right now is about pregnancy. So if any of y'all are preparing for the fourth trimester, then that could be a good class. And then I don't know if I'm allowed to say, Haley, you can't stop me. Next month is the postpartum class that, once again, the same 3 experts really representing that multidisciplinary approach when it comes to sexual function will be free to all users on the platform in October. So thank you for doing that with us. We're so excited.
Yeah.
Absolutely. Thank you for having us.
Yeah, one question we'd gotten was, are there actually different types of Kegel exercises for labor, like when preparing for labor versus postpartum, that you should think about? And I'm curious on this answer too.
Sure. Well, there's not really different types of Kegel exercises. A Kegel in general is a pelvic floor muscle contraction, but there are different ways to integrate it into exercise routines. And what that looks like is different for everyone. That's the strengthening aspect of that pelvic floor preparedness stage. Also, we want to look at then, what is that pelvic floor muscle's flexibility and ability to coordinate? Like in particular with intra-abdominal pressure and directing the relaxation of those muscles, because we not only want strong pelvic floor muscles, but we also want flexible, coordinated pelvic floor muscles. So it looks different for everybody. but we want to make sure that all of those functions are intact and that you're using your muscles at the right time in the way that you're asking them to work for preparation for birth and labor and delivery. I hope that answered the question.
Yeah. And I think you touched on this a little bit, but I know, there's lots of different ways that you can give birth. And so are there any like differences or nuances for a C-section versus vaginal delivery when it comes to like healing and sort of recovering?
I mean, it depends. It's hard to say. Like we kind of mentioned, our pelvic floor muscle may tend to be a bit more overactive after cesarean delivery, but that's not necessarily the rule. I think that anybody who has a cesarean section should have the ability to have rehabilitation after a cesarean. I think in any other injury or surgery, we should expect to have rehab after, you break your finger or twist your ankle or have like a knee replacement. You expect to teach those muscles how to return to functioning and be strong again. And it's just not the standard for cesarean section. And it's a huge surgery. And I know I guess I feel like thankful that I was a pelvic PT and kind of had that information after my cesarean section, because it was even difficult to navigate as someone that has the experiences and has rehabilitated those through cesarean sections before. But I think that it includes so much more than just your pelvic floor in cesarean rehab. And it's certainly something to prioritize.
Yeah, and I think that it's that question we have to answer, unfortunately, like all the other questions, which is that it's not just like vaginal delivery or C-section. It's like this huge gamut of things, right? Mm-hmm. Some people come in and they have a small baby and they have a quick labor and they push twice. And that person's vastly different from someone who came in, not in labor, was induced, then pushed for, that was in labor for 3 days and pushed for however many hours, and then had a C-section where the baby was big. There's the gamut of birth is why we all love to talk about it so much, because no two are ever the same, right? And even within people, right? So one birth to the next can be vastly different. And so I think that it's hard to make those generalizations, but there's things that can affect the pelvic floor from just the weight of the baby itself, right? To the mode of delivery, whether it's a vaginal birth or sometimes it's an assisted vaginal birth, and then also like the surgery and then potentially complications from either of those. So, and of course, when you have a C-section, there's obviously an abdominal incision, which adds another layer of, possible sort of effects and side effects to the picture. So that's the thing, is there's not one right way for everyone. And also, like a C-section, this is something that's really near and dear to my heart, because I just feel like we experience so much pressure around birth and early pregnancy as women. A C-section is not a failure. For many, that's the exact perfect thing that you need. Always we try to have vaginal births whenever we can, but sometimes that's not possible, and that's nobody's failure or fault. It just is what it is. And I really view C-section like, aren't we grateful that we have it, right? Because there are so many things without it that, can really go wrong. So just whatever internal sort of pressure or, I don't know, guilt that you might be feeling, like just know that we're all here as moms and as, women's health providers to do the very, very best that we can. And whatever that is perfect,
I love that.
Yeah.
Exactly.
Well, why don't we, that's feel like a great note to end on.
I feel like we need to hug now.
So I want to thank everyone for joining us. This has been so helpful. I as always, learned so much from these women. So thank you guys so much for your time. And where, I guess, Dr. Harper, how would people find more about Rosy? And maybe Ashley, you can give a little plug for Origin too.
Yeah, for sure. We would love for everyone here. If you don't have the platform, you can go to the App Store, Google or Apple, and just download the platform for free. There's tons of educational content that's accessible for everyone at no cost. We also have a library of erotica. If you're looking for a way to remember why you love the Peloton, then erotica is for you. And then we also have classes, just like the ones we were talking about, wide array of topics. I mean, just the library at this point, which I'm so thankful for, is extensive. And then we have a website, meetrosy, meetrosy.com. And then our Instagram is at meet_Rosy. So we'd love to see y'all everywhere.
Perfect. And Ashley, how do people find you?
Yeah, and then so you can find us on theoriginway.com, which on our website, you'll be able to book, learn about the different areas that we treat.